All right, good evening. So, what I wanted to talk about today is the media. What do I mean by that? Well, for example, we got CNN, Fox, like you got stuff like The View that's one sided. Um, Now, I'd been kind of looking into some things, and I mean, it's no secret that the media isn't really reporting, they're either reporting half truths or they're pushing their own agenda. And I have this I wouldn't say gut feeling. I would say this want I have to just talk to people about things. And I've also been giving thought to maybe just having this channel as somewhere where I can voice my opinion, get rid of some, just stop with the gaming. Because I love gaming. Don't get me wrong. I know there's a lot of people that do. But maybe that's not what my channel should be. Because, quite frankly, I wasn't that great of a host, if you ask me. Forewarning, smoking is addictive. It will destroy your lungs. Don't do it. That being said, back to media. There was a point in time when you could trust the media sources. They did their thing, they were actually journalists, they weren't just pushing an agenda. But nowadays it seems that's a lot less plausible, a lot less truth, rather. And I apologize, it's late, it's almost 11. I have to be to work tomorrow, so that's why I'm kind of groggy. My head's kind of not all there. I'm just tired, but I was thinking about it, and for instance, I found out that Colorado had started differentiating between deaths of COVID and deaths with COVID, meaning that, okay, so statistics, there was inflation. They were counting people who had died with COVID in their system as a COVID death, even if COVID was not the primary source of the death. Somebody could have, okay, for instance, what this guy where I got my stats from, is a reliable source. He does nothing but proves facts and looks up statistics. Well, Colorado was one of the first states to want to differentiate. The death toll dropped by 25% when they started, making sure it was a COVID death. Now, think about that. COVID was one of the first states, and I don't know if any other states yet this time have started doing that, but that's a big number. 25% adds up. And the reasoning would be, for instance, if somebody went into a hospital and they passed away from natural causes or from a disease that wasn't COVID, a heart attack or something, maybe they would get a sum of like 5,000 or whatever. But then you add in this COVID death toll, and they get more funds for a COVID death. They have machines reserved for COVID only, leaving fewer machines for people who do not have COVID. Now, how does this affect the media? Well, the media is pushing the numbers. Now, they're not journalists anymore, because if they were really journalists, they would have looked at Colorado and they would have been like, oh, hey, let's let the people know about this. Or just other things, and there's just so much on my mind. I'm sorry, guys. I got so much going on in my head. But, I don't believe that the media, I don't want to say they can't be trusted, because I do believe they at least tell half-truths at the very least. But I do believe they are pushing agendas, rather it be personal gain, rather it be profit, convincing people this or that. And I don't know who would be in charge. I have ideas, rather it be Big Pharma or some other company or someone that's, I'm sure I sound like a conspiracy theorist right now. But give me just 1 second and I'll look up the statistics myself. Don't start smoking, kids. It is not good for you. But I'm bringing the statistics up myself here. Can't type with my watch on. Oops. Looking for my keys here. Okay, and this is how big the number is. I'm going to probably skim through this article a little bit. And this is posted up by the Colorado Sun. Nearly a quarter of the people Colorado said died from coronavirus don't have COVID-19 on their death certificate. Now, there's a lot of reasons that could be, but more than likely they did not die from COVID. They just reported it as COVID and then filled out the death certificate properly. Now, let's see. I'll try and find good points here. And this might be after they decided to differentiate between deaths with COVID and deaths caused by COVID. So we'll see. We got the number of coronavirus. Okay. So I don't see when this was posted either. Okay, here it is. This was posted last year on May 15th. So probably around the time of the whole differentiation between. So right here, this sentence here, the number of coronavirus deaths in state figures topped 1,000 earlier this week, and the number stood at 1,150 deaths as of Friday afternoon. This was last year, May 15th. But officials with Colorado Department of Public Health and Environment revealed during a call with the reporters that the number does not represent the number of people who have died due to COVID-19. So this is just talking about, essentially from my understanding of it, because I'm not the most educated person in the world, but how I see it is the death toll is inflated due to the 25% of the 25% that was not reported correctly, I guess would be the best way to put it. The people who passed away with COVID in their system but did not pass away due to COVID. It goes on to say, here's some of the figures. Instead of the death figure CDPHE has been providing for weeks is more accurately described as a number of people with COVID-19 who have died. Yet again, deliberately re-saying that these people died with COVID in their system, but not due to COVID. For any reason, the number of people whom have died and have COVID-19 listed on their death certificate is 24% lower, 878 people, according to CDP EH's latest figures. So the actual amount of people whom would have passed away due to COVID would have been around 878 people. Now, I'm not a mathematician. I'm no good at math at all. Trust me, I have to write it down, use a calculator, double check. Not good at math at all. But going from, 878 people to 1,000, that's quite a few people that they're saying, didn't die from COVID. And this could be happening all over the U.S. I mean, it's possible. And rather they're not performing an autopsy, or if they're just not reporting it, or I don't know. Like I said, I don't live in Colorado, I don't know. However, I wanted to touch on something more serious, more, something that could possibly, make a difference, give somebody that has a voice the ability to speak up and say something. Because I myself, I don't know where to start with any of it. And maybe if I keep pursuing this style of video, maybe I'll end up getting better at it. But then it goes on. Let's see, we got... some people in Colorado were, asking an obvious question. They wanted to know about the people of Colorado. Okay, I'll just read it because I can't paraphrase very well. What the people of Colorado want to know is not who died with COVID-19, but who died of COVID-19. Yet again, and that's fair. That's family members and somebody's, father, somebody's uncle, somebody's daughter, mother, aunt. That's something you want to get right the first time. You don't want to mess that kind of thing up, or false reports. Let's see. Okay. Well, it says here, alright, I'll read these few sentences here. It says, there's only a few cases that we're aware of where... I'm sorry, hold on. I'm trying to sit way back here and read it, but it says there's only a few cases that... Mountain Dew carbonation. That we're aware of where there is some gray area. But where there is gray area, we should always use for reporting the numbers that come from the physician or from the coroner that actually addressed the patient or inspected the body. That's fair. They want to use, what they should want to use is the reports that come from, the coroner, somebody who did the autopsy, somebody who was dealing with it, so maybe that's part of it. Maybe something got handed off to somebody else and they just filed it as COVID without actually knowing, due to COVID being in their system. But in that case, I also would have to say that if you're told to file out a report and you don't have all the information you need, the necessary information, you should ask the person who did, who does have that information. But we got, let's see, conflict between the two systems boiled over this week when state representative asked the jurisdiction attorney. Sorry, I'm trying to find something that's let's see. Wait, hold on. Okay, so here's a prime example of what I was talking about. So there was this attorney who started digging into stuff, and I'll read afterwards. I just didn't want to throw that attorney's name out there. But it was reported by 9 News in a separate report by CBS 4 that the county's coroner classified an alcoholic poisoning death in his county as a coronavirus death. Both men accused CDPHE of changing death certificates to add COVID-19, but CDPHE officials deny doing so, saying there was confusion about the different reporting systems. Death certificates are not public record under Colorado law. Now, I don't even know how I feel about that, because someone somewhere is messing up or purposefully altering them. That being said, this coroner is saying, somebody in this, what does CDPHE stand for? Oh, Colorado Department of Health and Environment. Okay. Wait, I missed the P. Public Health and Environment. So, what this coroner was saying was that somebody at Colorado Department of Public Health and Environment he accused somebody in this department of changing the death certificates, which is it entirely possible? Yes, we're all human. We all have that slight inkling of greed. So it is possible. Somebody could be altering it. Let's see. But they went on to say that they denied it, saying, the death certificates are not public record under Colorado law, saying that there was some confusion about the report system, which, if you're in a position such as this where you're going to be in charge of something like this, you get the forms, you get the paperwork, you learn how to fill it out. You're showed what goes where. You're shown what goes where, sorry. And then there's some quotations here from the head of the Colorado Department of Public Health and Environment. Says, like I said, I'm tired, guys. We do not change death certificates and have not changed death certificates. That was said by the head of the CDPHE's Vital Statistics Program. Let's see. The answer clearly did not satisfy the coroner, who joined the media call Friday. So there was a call, he was in the media, and pressed the CDPHE leaders for a better explanation. he went on to say, I'm assuming he said this during the call with the media there. He said, you guys record every COVID case that dies, whether it is the cause of death or not. He said, to my knowledge, you don't do that with influenza. Is that correct? And they went on to say, no, or is reported differently, but there are other diseases where same dual systems. So what they were saying was that there are systems in place where it is dual systems, so dual two systems in place to where they have a reporting system that is similar, or if not the exact same as what it is for COVID. But there are differences between different reporting systems. So influenza, deaths by flu, pneumonia, they're probably reported differently than COVID. So what they're saying is, in their retort, they were saying, look, there are some things that are reported differently. They go on and say that it's not uncommon to have some divergence in the reports on the death certificates. In other words, they said there can be slight discrepancies. To me, that just sounds like excuses, honestly. There's no direct answer given. Maybe the head don't even know. That could always be. Like, the head of this statistics program might not even know or be aware. But as of the point in time that this article was made, the death toll was 24% lower after they started differentiating. So there's that. Now I'm gonna stop my broadcast here soon. I'm going on 22 minutes here, but I mean, maybe I can find something a little bit newer. Let's see. Alright, I actually found graphs and charts. So, let's see. Is this just cases, or is this like the death count? Sorry, I'm trying to figure out what I'm looking at here. Okay, so this is the death count, daily changes. United States, Colorado. So this is still last year's on into this year. So let's see, that's December. And they've been experiencing, I mean, sure, there's still peaks, but the last high peak was around December 15th with 116 deaths. 7-day average is 89, and that's December 15th, 2020. As of February 24th, yesterday, there was 9 deaths. Average of 10, 7-day average is 10 by that point. So they have been dropping, but it also dropped before. In 2020, it looked like the highest they peaked was, let's see if I can get this right on that peak. Okay, April 24th, 2020, 115 deaths, a 7-day average of 40. That was the peak. Then they kind of started decreasing. And at one point, I thought I saw 2. I did. Okay, so June 28th, 2020, there was 2 deaths. So, I mean, they dropped, but at some point they peaked again, and then it's dropping again. So, I mean, I'm not too for sure on what's happening because it peaked really low for a little while. From the lowest peak is in August, I believe. Let's see. Oh no, there was 0 deaths there. So September 7th, 2020, they didn't have any deaths. And it just stayed almost a flat line at, right between, what it looks to be a max of 15 July 31st, 2020. And that's the highest until October 15th, which went up to 1 death. And I'm not for sure if I'm even reading this graph right, but right from October 15th. Oh wait, no, I'm wrong. There is a small peak there. So October 13th, 37 deaths. I wish I could zoom in on this thing. But right after that, it starts going back up in November. 13, 31, 47. And it's just kind of all over the place. And then it starts dipping back down. So that could have a lot of implications that I'm not smart enough to tell you about. But I'm starting to think that maybe the amount of COVID deaths are being inflated rather for personal gain or whatnot. I think we need to start taking and looking at the statistics ourselves. Start taking things into our own hands. Start figuring out, hey, this is a lot to take in already. Why escalate it? And hell, I almost said something. But no, like COVID-19 has become political. It has been drawn into the politics to where they're using it as their own kind of tool, I guess. They're using it as a political tool, which isn't right, in my opinion. People should come first, period. And to start with that, you would have to address this, get the vaccine out to many people, and I haven't even gotten the vaccine myself yet. For a couple reasons. I haven't gotten it, my girlfriend hasn't gotten it, my son hasn't gotten it. Now, I work in a nursing home, and I guess, I'm right there, but I don't know. I just don't buy into everything that's pushed by the media. And I hope people can start noticing things themselves and maybe opening their eyes a little bit. And I guess I can just end this with take care of yourselves and your families. Let everyone know, everyone you love, let them know. We don't know when somebody's going to get sick. It just kind of happens. And all we can do is hope for the best, that maybe other states will start taking a better look at things and hopefully end up getting everything kind of sorted out, because if there's an inflation of 25%, that's going to add up, especially if you're looking at the total across the country. And maybe if I can find the right way to and get comfortable doing this kind of thing, maybe I can start talking about more serious stuff and cover some things that at the moment I don't know if I'd be too comfortable covering. But the gaming thing wasn't really working for me, so maybe I could just do this and go on a little spiel and look up some statistics articles or something so I know I'm getting my facts right. That's one thing I really want to make sure I get right, because that's what needs to be out there, is the truth. And I don't think anybody really trusts the government to give us the truth anymore, or the media to give us the truth anymore. And you can only believe hearsay so much. I mean, I read an article, and this was on Facebook. Somebody had made an article saying Jim Carrey had passed, and this was a couple years ago I'd seen it. And it's like, what? And I bought it. I didn't click on the article. I went and Googled it because I didn't know if the article would just spam that would have gotten my phone a virus or something, you know. And maybe that's just my age talking, but I know a little bit about computers, not a lot. But anyways, I wish you all the best. Take care of yourselves and do what you can to just, like I said, take care of yourselves, your families. Let everyone know, you know, how much they mean to you. Because if somebody you love does come down with COVID, they're isolated into the hospital room. And from as far as I know, like, my girlfriend was put into the hospital, and it wasn't for COVID, and they didn't even let me go and visit her until they confirmed she didn't have COVID. So we'll see kind of what happens. Like I said, I don't trust the media, but I haven't for a long while. I don't watch the news. Everything's pushed one way or another, and it's not what it should be. I'll leave it at that. Have a good one. Drive safe. The roads are getting better around here. That sounded horrible. The roads are getting better around here. And hopefully we just don't have any more snowfall. Anyway, take care. Good night.